Hello and welcome to another episode of Educational. I'm Roy. So what we want to do is not only chronicle our journey, but we want to talk to others going through the same journey. We also want to talk to professionals that can come on and help us all through this journey. And so today we're fortunate enough to have Joy Poskozim. Poskozim. Hope I got that right. So I'm sorry. Joy is a 1999 graduate from NYU College of Dentistry. She has also completed her General Practice Residency in 2000 and started practicing general dentistry in Gramercy Park, New York. She opened her own general practice in her hometown of Chicago in 2006, started practicing geriatric dentistry all over Chicagoland in assisted living communities, memory care homes, and those that have to stay home. In 2008, Dr. Joy entered a fellowship with the Special Care Dentistry Association Geriatric Council in 2020 and her CDP Certified Dementia Practitioner in 2021. Wow, that is an awesome resume, Joy. And I would like to also I got a couple of these, the initials after your name, the DDS, Doctor of Dentistry, the FSCD.
My fellowship.
The fellowship, okay, and then the CDP is the Certified Dementia Practitioner. So yeah. Awesome. Thank you so much for taking time to be with us and welcome to the show. You know what, really, it's a funny story how we met. Actually, it was on Instagram. I was looking through posts, but you know what really stuck out was not only the geriatric practice, but also that you take your practice into the communities and into people's actual home. I think that is such an awesome thing because transportation can become such a barrier, not only for dentistry, but for seniors and getting people, really anywhere they need to go.
No, it's absolutely true. And, it doesn't really affect you until it hits your own backyard, so to speak.
Right.
And, it started with my grandmother and, she needed a new lower partial denture and I'm 5'11", and so she's my height, my build, but horrible sciatica going down her right leg. And, children and countless grandchildren eager and willing to help her, but she didn't want to move off her comfy chair, off her easy chair,
right.
With her heating pad and her public television, and she was good to go. But she also wasn't eating, she wasn't eating, and she was beginning to lose weight, and it was getting to the point that she really should not have been losing weight. We literally got to the point where one would say now, failure to thrive. And it wasn't like she was in any pain with her mouth, it's just that she didn't have the proper amount of teeth to have a full diet. And so she was beginning to, have more liquids, and we were really relying on that Ensure that I'm sure we're all familiar with. Yeah. And unfortunately, as great as Ensure is, it's simply just not enough. And she actually began to grow tired of the flavors. Yeah. So because she was using it all the time, and which can also happen. Right. So fortunately, she was 10 minutes from my office. And so I went to her, made her a lower partial denture. And I remember inserting it on a Friday. And the great thing about making dentures and doing this in someone's home is that it's all palliative. We don't need to worry about the teeth. We don't need to worry about any medications that they're on. All we need to worry about is whether or not we can take impressions so that we can use those impressions as templates to make the dentures. And I have to say 90% of the time, no matter what kind of medical case a patient or a resident is, we're pretty much able to take an impression, especially if they've had dentures before, because there's that muscle memory there. Okay. So anyway, we made her a partial denture, and she went to church on Sunday, and she went to see her ladies afterwards. And when she talked, you only saw her lower teeth. And when she spoke, she was so excited to be there because she hadn't seen her Women's Guild in a long time. They're like, Jeanette, you've got your teeth back. And she's like, well, my granddaughter goes to people's homes. So if you need her, let her know. Completely unbeknownst to me. And so I get a phone call that Monday. Someone took her up on her offer and said, can you do that for my grandmother? make a long story short, went, never really thought about it, but okay. Story goes, she's, stroke victim, 2 years, completely, not speaking. And they were noticing a smell from her mouth. And to make another long story short, she had dentures. They were brushing her dentures twice a day. So once again, similar situation, fellow parishioner, wonderful family, countless grandchildren, eager and willing to help. This is not due to neglect. They just didn't know what they didn't know.
Yeah.
And so,
She didn't tell them.
No, she didn't tell anybody. She was a very formal woman.
Okay.
And very quiet. She was a widow at this point. So maybe her husband knew, maybe the grandfather knew, but he has passed by this point and no one knew. And I mean, the amount of caregivers that have seen her by this point, no one had learned to lift up the upper lip to see if there was a line there to show plastic or drop the lower lip to look for the same thing. They were literally brushing her denture teeth.
Wow.
Now, granted, beautiful dentures, let me tell you.
Yeah.
She paid a fine, she paid a fine price for those dentures, but at the same time, no one knew.
Yeah.
And so taking those dentures out, you can imagine what was underneath. We had to get some medications involved, and I had to get the medical doctor involved because of some serious issues that were beginning to form underneath those dentures, considering it had been 2 years. And she was eating. She did not have a tube. She was eating. So food, she was able to consume food. And fortunately, it was a situation we could reverse, but at the same time could totally have been avoided if someone in that path of her getting better had the wherewithal, the knowledge, the education on oral care, on what to look for in case someone does or does not have dentures.
Yeah.
And that's what really created my advocacy, and my career trajectory took a complete 90-degree turn on promoting and taking care of seniors, especially seniors who can't communicate with us. We're trying to find secrets to potential problems. Yeah. And also prevent problems.
That's awesome. I think that, not only that it changed your career trajectory and you're able to help these people, but the other thing I wanted to bring up quickly is the communication. We talk about that communication sooner rather than later. While it's a corny thing to think about, it's good to talk to mom and dad before they get in a bad position. Like, what, do you have a pacemaker? Some things, like you said, maybe we would know because they were in a hospital and had done, but like dentures, so make it go to the dentist, get that taken care of, and maybe a child wouldn't even know, or if they lived out of town, wouldn't have been there for that. So there are a lot of reasons why it can happen, but I think we just need to stress the communication part is not only for that, but for other things, medications, so many things. But anyway, have the conversation, write it down.
Absolutely. And also, have your power of attorney know. I mean, if you are the loved one and you're the power of attorney, I mean, are you strictly medical power of attorney? Or are you medical and financial power of attorney? And if you are medical power of attorney, that includes dental. So that information has to be provided to the POA in order to make sure that sound judgments be made, decisions be made for someone, for their loved one. Yeah. I had a situation where I was going into an assisted long-term care community, and she had early onset Lewy body dementia, so she was no longer communicative. Once again, noticed foul odor. They were brushing her teeth, except they weren't her teeth. They were all on four implant supported dentures. And so all on four implants. So she had a total of 8 implants, 4 on top, 4 on the bottom. Beautiful, once again, beautiful work, beautiful dentures. When she was entered into the home, in order to handle it financially, they actually had legally divorced so that she could, financially be in that home, which we hear quite a bit. Well, he kind of took the ex-husband kind of took that to the extreme and kind of just fell off the face of the earth. And so they were not able to reach him at this point and did not know how to get a hold of him, as well as find out what's going on with her medical care as well as her dental care. So once again, lifting up the upper lip, it's going to be a common theme, lifting up the upper lip to see
Yeah.
what's going on? And it turns out that she did have these beautifully made dentures. And I had to show the caregiver, and then also to help show, the next shift and then the third shift, how to take them in and take them out and clean them. And they can be cleaned and taken care of just like any other denture. But once again, we don't know what we don't know. They didn't know that she had dentures, and it turns out that she was actually became a ward of the state. So there was a guardian put into place for her. The guardian knew, but they were trying to get a hold of the ex-husband. So it's so, to make a long story long, there is so important to make sure that there is at least one person in your corner who knows what's going on, not just with your mouth, but with your eyes, your ears, the rest of your body. It saves so much time and money in the long run, and could save a life.
Yeah. Now for caregivers, maybe you could just give them a tip if you come in, somebody's non-communicative, or if they can't answer, whatever the reason, when they initially brush those teeth, what are some, I guess it's simple, just lift their lips up and look, but they could probably take their finger and run on the gum line, or
Absolutely.
basically that's something that probably needs to be done sooner rather than later, just to make sure that somebody hadn't forgotten that they had dentures and, run into this, make a bad situation even worse.
Well said. Well said. Absolutely. So what I try to recommend is if there's going to be somebody who is going to be entering a home or is going to be staying in place, but now is going to be receiving care, then an oral health assessment is provided. Now, there are, with the activities of daily living, unfortunately, oral care is not listed specifically. So some places are better than others, and some agencies are better than others in helping to promote oral health care. There's also fear of being bit. So that is another concern as well. So if someone is trying to take a look and they don't know how to do it right, they haven't learned the methodology in order to do that so you don't get hurt, they're going to avoid this at all costs. If they know someone who's gotten bit, or they're just afraid of the mouth in general. I was in a situation yesterday where it was a stroke victim, minor speech. He was getting better. It had been less than a year since his stroke, and upper denture had lost a bunch of weight. The denture no longer fit, and the daughter was at her wit's end because he really, once again, cannot lose any more weight. So contacted me. Great news. It was a great denture. It's a beautiful denture, but it's too loose on him. It literally was falling out. And what is kind of interesting is that the denture is actually resting on, dental terminology here, buccal fat pads. So not only when we lose weight do we lose weight in our bodies, we can also lose fat in our mouths. And so when that happens, there's space now that forms between where the gums have receded or condensed on top of the bone and where the denture used to sit. We can reline that. We can reline the denture. We can reline the partial denture. And so that was, that is, great news that, they were able to do that. But, fortunately for the family, everyone was on board. Everyone could tell that, what was going on. And we were able, I took the impression yesterday, we should have it back in about 2 weeks. But what I was also looking for signs and symptoms of certain issues to be concerned about is dry mouth. The mouth can be incredibly dry, and there's actually 2 ways the mouth can be dry, and that's by quality of saliva and quantity of saliva. And the quantity we notice more often, and that's for anybody who can become dehydrated, right? If we become dehydrated, we're not producing as much saliva as we should be under normal circumstances, and so we feel dry. It's the quality of saliva that becomes a big deal for our seniors, because they may have some resting saliva in their mouth. They may be producing some saliva, but the unfortunate thing is it might be thick and ropey and maybe mucusy and not as clear as it should be. And it's not really doing its job. Our saliva is supposed to allow us to help break down food so that we can swallow. What it also is supposed to do is help us speak. And also to help move things around in our mouth. So if we don't have a whole lot of saliva, the stuff that normally is, floating through our mouths, our oral bacteria and such, they'll kind of stick to the teeth, and that becomes a problem. And as well, tongues can stick to the roof of the mouth, and that could be a problem. And so I'm looking for for looking for dry mouth. I'm looking for what kind of appliances they may have in their mouth. I'm looking for any discolorations of their teeth. I'm looking for swellings. I'm looking for abscesses. I'm looking for pimples. These are the things that I'm looking for that can become a truly serious issue that can be 100% avoided if properly taken care of and if caregivers know what to look for.
Okay. Yeah, and I think that another reason we were so excited to get you on here is I don't think most common people understand the magnitude of problems that can start in your mouth. It can lead to, and I'll let you talk into this, but I know heart disease is a big one that it can lead to that. Also, if you don't get your plaque taken off timely, that it can actually start rotting your jaw bones. I mean, anyway, I'll let you talk to
I
the.
knew you knew so much about
I,
it. Look at you.
yeah, I know.
So this makes me love you even more.
So it's kind of interesting. The term plaque is a general term, and plaque in the mouth is bacterial poop, because they're living things. They poop too. Bacterial poop, and excess foodstuffs that don't get digested. I swear to God, and I talk about this all the time, and even to littles. I had 2 little girls walking out of my office because not only do I go into homes, I also have a brick and mortar. And by the end of the appointment, those 2 little girls, they were 4 and 6. They're bugs, poop, and food. Bugs, poop, and food. It's just the best thing ever.
Oh my gosh.
We got to start young. Young. But anyways, so that's what, plaque is for the mouth. And that's what we're brushing twice a day. I ask people of all ages, why do we have to brush our teeth? And I would have to say 90% of us don't know. And I wouldn't know if I hadn't gone to dental school, which is a shame, right? There's not enough information out there that's readily available that we actually want to read, about oral care, right?
Yeah.
So bacterial poop and excess food stuff that don't get digested. So there's that plaque, right? I'm going to actually start with the brain, because the plaque, the bacteria, Piriformis gingivalis, that causes oral bacteria, or is one of the bacteria that causes plaque, the main one, can cross the blood-brain barrier in those with compromised immune systems and now help trigger the plaque deposits in our brain, can start the plaque deposits that are synonymous almost with Alzheimer's, right?
Interesting.
So the early onset dementia, which is incredibly scary. NIH, the National Institute of Health, came out with this huge study that just came out last year, July of last year, that has proven this. There is research out there, and now it has been defended that we now know that this occurs. So Piriformis gingivalis, horrible. It's unbelievable, and it is what it is. But the bottom line is less plaque here, less bacteria, less bacterial migration to the brain. So that's number one.
Yeah. That's interesting that you mentioned that, because just this morning I was reading an article on audio, and it said that people that have lost some hearing are 200% greater risk to get Alzheimer's as well. So I just think it's interesting of these things that nobody's really ever talked, or I haven't heard about.
Wow.
Starting in the ears or starting in the mouth, that can actually, I guess, maybe exacerbate the Alzheimer's process. That's unbelievable. Anyway, I didn't mean to interrupt you, but I just thought
not at all.
that's
No,
interesting.
This is a conversation, absolutely. Yeah. The next one would be, I'm going to say the lungs. So oral bacteria migrate. I consider it. I tell my patients that it's due to overpopulation. They want to spread out. They're still doing the research on the why. But suffice to say that 85% of bacterial pneumonia is oral bacteria.
Wow.
So yeah, very scary.
Wow.
Yeah, very, very scary. So the bacteria that decide to travel outside of the mouth can get into our lungs, wonderfully oxygenated, wonderfully moist, warm, great environment for them to grow, and a great place for the bacteria to help create the pneumonia that can ultimately, for those once again with compromised immune systems, death. So Yeah, so very scary. And then the third one would be, once again, we've got plaque in the mouth, plaque in the brain, right? And now we've got plaque in the arteries, which can then lead to the heart. So for those that have certain heart conditions, it's not all heart conditions, but for certain heart conditions, they are required to prophylactically or before a dental appointment take antibiotics. And it's called prophylactically because it's to help to prevent any issues. It's not that they already have an infection, it's to help prevent an infection. And it will be anything from amoxicillin. It's 1 hour before, if they're allergic to amoxicillin, it's another type of antibiotic, a broad-based spectrum antibiotic that is taken beforehand before a dental cleaning. And some of my residents, will still be, require this. It's not age dependent. It truly is a heart condition dependent. What can transpire? Endocarditis. The endocardium is the inner layer of our heart. And if it's muscle layer of our heart, and if it becomes inflamed, then we're looking at potential, chronic heart disease, heart failure, and potentially, once again, unfortunately, death. So we, especially for those with pacemakers and with stents, they really want to make sure that they prevent any bacteria, oral bacteria, foreign bacteria for that part of the body to create, a home or a subdivision or a community in that area. And so we're prophylactically providing this antibiotic for them so that prevents that from happening. So oral bacteria can penetrate into our brains, our hearts, and our lungs. And even more reason why taking care of the mouth is literally taking care of 3 vital organs.
Yeah, and the basics, I guess, even before we get that far off, is that a lot of people that have teeth problem, it hurts them to eat. So like you were saying, they don't get the nutrition, or they maybe if they don't have any at all, they can't eat solids. So again, getting the protein and things, they have to make adjustments. So this is such a serious, the mouth is such a serious thing that, and I know that you know this, and I probably will set you off when I say this, but just that as we get older, insurances, Medicare, Medicaid, it's different everywhere, but in general, we tend to pay very little attention to elderly's mouth health.
It's true.
And it's just unbelievable. I used to think it was terrible before you just told us all these other things about, the brain and the lungs, but now it's even more that, we're missing a very big component here in providing care to our elderly, that we don't take care of this to ensure, because it just,
such a reactionary thing. I mean,
it's true.
If you don't work on the preventative part of it, I mean, you're just reacting to however you take care of it, and it's an emergency situation by the time they see you.
Yeah. Well, and it's serious because some of these things, the heart disease and the brain for sure, they're not reversible. It's like once we let it get to a certain point, it's just too late to do anything about that. So anyway, I just, it's amazing. I will say that. I mean, I'm actually speechless after hearing that. One thing I was going to say or ask you about is my dentist recommended. So I've got the little cool flossing mechanism. I can't use regular floss for some reason. It's just difficult, but I've got that, it's got like the little horseshoe on it where you stick it back and do it. It's good. But they were still finding some plaque buildup on me. And so they recommended I use this gum stick. It's the little, it's just like a rubber toothpick almost, but even after you floss, then you do this thing. It's been tremendous because I can't, this is gross sounding, but I can't tell you, like after I eat.
My world.
Yeah, right.
That's what I do all day, please.
But after you eat some popcorn and you go do the regular floss, I'm very surprised at the stuff that still comes out when you use the little gum sticks. It's like, so for all these years, we think we've been doing enough, but I'm a novice. I'll let you decide if people should use it, but I think it's a recommendation that people should know about. It wasn't that I was opposed to using it. I just didn't know any such thing existed. And I think that's been a topic or a theme that, me and you have had with Terry in our previous conversations, is a lot of this is just, we don't know what we don't know.
Exactly. You know, with the case that I had yesterday with the relining of that denture, she's a very holistic person. You know, she's very concerned about what, you know, she's putting into her own body, let alone into her father's body. And so she had found these bamboo based toothpicks, and she figured because it was bamboo, it was fine for the mouth. And I had to very politely, but professionally and firmly say no, absolutely not. Because unfortunately, even bamboo can splinter, right? He bites down on it because he's now watching TV and he's not paying attention to his daughter, or she gets distracted or whatever. He has 6 teeth left on the lower front teeth. So we're only really concerned about getting the spaces in between those front teeth where we have the best access to. But once again, we unfortunately, you know, he is, you know, he's not fully cognizant, and he might not fully respond to her requests or commands, if you will. And so I also had to recommend something very similar to what you're talking about, you know, a gum-based product, GUM as the name of the company, Sunstar company, where they make these amazing, they're called interproximal cleaners, interproximal, in between the proximation of the walls of the teeth, right? We've got this triangle area and we want to get in between there because our teeth are curved, right? They're not like that. They're like this. So we want to get up in there between the teeth and the gums. Why? Because that's where the bacteria live. I mean, we wanted to make it like it's a hurricane twice a day in our mouths every day. You know what I mean? We want to make it like it's so disruptive for the bacteria that they come up to the surface, and now we are rinsing and spitting and you know, getting rid of, you know, all that extra bacteria and plaque that we can see, because we have to remember something. And I have to remember it too. Bacteria is microscopic, right? So if we can, and so ideally is bacterial poop. So if we can see this stuff, you can imagine the trillions of bacterial colonies that have created this and how long it's taken to get there. And I also too, it's, you know, this is a chronic condition, right? Gum disease is chronic. It's not acute, meaning it's only happened in the last 3 to 5 days. That's a big problem. There's a huge similarity between gum disease and diabetes, because for the first, you know, few years, potentially, you're completely asymptomatic. You don't have any issues. You don't have any pain. You might not have any inflammation. Or you figure, you know, every once in a while you brush your teeth and it'll go away and you're fine. And oh yeah, the gums are pinker again. And yay, I'm drinking more water. Woo, woo, woo. But if we're not consistent about it, then those things will begin to build up. And then when you do have pain and you know, I would be called in to take a look at it. This is something that I would have liked to have seen 3 years ago when this person was first decided to stay in place, and with the first diagnosis of dementia, and when they first had an agency come in, you know, it would be very wonderful, ideal circumstances is that I'm called in too, right? So we've got the nurse practitioner, you know, coming in, maybe we need some physical therapy and occupational therapy after a stroke case. But we're also calling in vision, we're calling in audio, and we're calling in dentistry. Because we don't know what we don't know. And if these things aren't being assessed at the very least, then potential problems can occur. And I think that's a problem across the country. It's not just in one part. It's just from east to west coast, north to south, is being able to address all the problems, once again, to prevent problems. What's that old expression? A stitch in time saves 9? Right? You know,
exactly.
We can nip it in the bud, not to use another colloquialism, but there you go. You know, if we can truly, you know, catch these things when they're small, so much easier to deal with, completely reversible, and a whole lot less expensive. Just saying.
Yeah, and it's just something I know it gets harder as it's difficult to transport people, and I think that's you know, the beauty of your practice, or part of your practice, is being able to deliver that care to where they are. So I guess, you know, I would challenge people to, let's don't forget about this oral care. Look out in your community and see what resources are available. There may be other traveling people, but the other part is find programs if you don't have it on your insurance, because I know that becomes a worry. You know, people are running short on money when they get old. So, you know, eating and paying the rent are top of mind. We tend to let other things go. So, you know, reach out and see what resources are available, because I know that every profession has people that try to help other people that don't have the resources for their services. So I would say that you're going to be able to find something. But it's just, I think the oral care is something we just can't forget about. Really, we should never forget about it. We're speaking to the elderly audience and their caregivers and adult children, of course, but this is something that really from birth, you need to get on it and stay on it, because it can create a lot of problems for you, even at younger ages as well.
Exactly right. And it starts with your own dentist, right? And so you start asking questions from the own dentist, and if the dentist doesn't have the resources, then it's usually what they recommend doing is contacting like AARP, because that's across the country, and they can be a very big help in finding resources for those that that require that kind of help. Because medevacs are horribly expensive, especially if they have to go up the stairs and then go down the stairs. I mean, I've had situations that prior to me, before them they find me, that they are literally calling the firemen in certain towns to, because smaller towns, to call the firemen to come get the person to bring them to a medical appointment or a dental appointment. Now, this is of course pre-COVID. This is before telemedicine has become so prevalent, right, in teledentistry. But once again, I had a patient who chose to stay in place, had her medical appointment. It was telemedicine, so he's pretty much it's the phone, and she's got the daughter's got the phone and everything. Now, if he was there, he might have looked down her throat, but she chose not to open her mouth at that time, and the daughter didn't feel comfortable in touching her mouth. Yeah. So, fast forward, I pull out 8 teeth from this woman.
Wow.
You know what I mean? So, yeah. So, there's a wonderful thing about telemedicine. There's a great thing about teledentistry too, but it's boots on the ground, actually being there and being able to communicate with this person, eye level to eye level, eye to eye, being at their same eye level, and having that extra time to really communicate, like we were just talking about earlier, having that communication and those communication skills so that we can provide as much care as possible during that time. That is absolutely huge. But yes, going to the dentist first, asking for help from the dentist, do you know anybody or have any resources? The great thing up now is that we do have social media, right? Yeah. And so there are Facebook groups that we talk to each other all our time in our closed Facebook groups. And so there'll be a post, at some point, saying, hey, we really need a mobile dentist or a house call dentist in Alabama, who can help. And so then we've got our groups, and one person in network and all that stuff. And so the information is out there. It's just a matter of knowing who to ask. So those are the two things. Dentist or AARP are great resources, and trying to find someone in your area to provide that type of oral care.
Yeah, let me talk about the misconception of, kind of getting back to dentures. Maybe there's a misconception that my mother has dentures, so she really doesn't need any oral care from now on. I would assume that is a very misconception, that even if we don't have teeth, if we have dentures, we still need to have our mouth looked at just to make sure nothing else is going on in there.
Absolutely. Oh, I could not agree with you more. The problem is that if the dentures aren't being taken care of appropriately. So if your grandmother was taking her dentures in and out every single day, and all of a sudden she's not doing that anymore, and the dentures are being left in, that is a problem. And if you don't feel comfortable in taking the dentures out, then find someone who does feel comfortable in doing that. And hopefully a nurse practitioner, a physician assistant, a PA, a dentist, a dental hygienist who makes house calls will feel comfortable in doing that for your loved one, because you don't want to let them sit, because the stuff in there will rot. And you get thrush, right? And what is thrush? That is a fungal infection that, once again, is completely preventable if the dentures are being taken out every night. And so it's crucial that, even if they're sleeping during the day, if they're having like a morning nap and an afternoon nap, it's perfectly fine to leave the dentures in, but not overnight. And another problem that we see too is that they'll take the dentures out, let's say, because it's just, once again, muscle memory is ingrained in them. They'll take the dentures out, but now they're sitting on a table or something. We want to make sure that the dentures stay wet. the plastic, the acrylic that is used for the dentures are required to stay wet because over time, if they stay dry, the material can actually become brittle and it can easier chance of fracture. So you really want to make sure that, you know, when the dentures come out that they're sitting in, if nothing else, just water is fine. It could be tap water. It doesn't have to be distilled, just regular old water, as long as it's sitting in something so that those denture, the acrylic stays moist and will be safer the next day for the dentures to go back in.
Okay.
Well,
So
we also, sorry,
no, you're fine.
we always thought as kids that Papa was just terrorizing us with his chompers in the glass in the water, you know, just trying to make it, oh, here, you want some water? Yeah. You know, okay, there you go. Now I know.
Well, I mean, isn't that a great life lesson of what can happen if you don't take care of your mouth? I mean,
Right.
Seriously, you know?
Oh my God.
So what about that? What about the denture care itself? Is there, if you put it in the glass, is there a tablet, a cleaner you throw in there, or just brush it, or kind of what's recommended for that?
Absolutely. So soft toothbrush, the acrylic is just as capable of getting, you know, of having problems as the teeth do. So definitely soft toothbrush. And then the tablets are fine. I don't care what brand you use. It's all pretty much the same. It's all going to be pretty much a form of bicarbonate of soda, you know, in a tablet form. I would not use baking soda. That's too abrasive for sure. Even the Arm & Hammer toothbrush or toothpaste, excuse me. Wonderful toothpaste, great for some people, not good for dentures, too abrasive. Also charcoal, the charcoal toothpaste have gotten to be very popular. Once again, not recommended for dentures, partial dentures, complete dentures, not recommended for plastic teeth.
Okay.
It's just too abrasive for them. But yeah, having them sit in, I have some patients too, that once again, they're trying to be more, you know, more holistic, less chemicals. 1 part hydrogen peroxide, just that typical brown bottle of hydrogen peroxide that you can get at any, you know, pharmacy, right? 1 part hydrogen peroxide, 2 parts water. And that is a wonderful whitening agent, right? And it's a wonderful cleansing agent. It's a wonderful antiseptic. One thing that I would not use is any alcohol-based mouthwashes. Alcohol is a drying agent. I am totally pro-alcohol. I just don't want alcohol. I don't want alcohol in my mouthwash. Yeah, because it's going to dry out that plastic and over time can once again help it break. So you're like, well, gosh, you know, I had it, I kept it in something. Water is better than an alcohol-based mouthwash. And also just as an aside, a lot of the generic, like the Target or the Walmart brand or the Walgreens brand mouthwashes tend to follow the Listerine formula. And the Listerine is 26 to 28% alcohol, depending on which flavor or which color you get. So, and not all Listerine products are alcohol-based, but that being said, it is safer if you have the choice between a Listerine product and water, choose the water.
Okay. So what are some signs, you know, we've talked a little bit about, of course, pain or maybe a smell coming from the mouth, but what are some other signs that somebody may need to seek immediate dental care?
Absolutely. An abscess or would be known as like a whitehead or a pimple on the inside of the mouth. So between the cheek and the teeth, down in the gum, in that neck of the woods. Usually not painful. So like a canker sore or a cold sore, that's viral. We know what causes that. We know that'll go away eventually. Those things that are painful in the mouth, when it comes to the gums, usually not so much of a problem. It's the ones that don't cause pain, once again, at the gum line, that are things that we need to be concerned about. Because what happens is bacteria has gotten in there, and bacteria are smart until they're stupid. They get to a certain point where they can't breathe oxygen anymore, right? They need to breathe oxygen. And so they're trying to find a tract. They create their own tract out to the outside where they can get some oxygen again so they can start breathing. And so they'll also create this capsule around them to stay healthy. Once again, you know, they're living they're organisms. They're very adaptive. And so they will create this bubble around themselves to protect them. And that bubble is your abscess. And if you burst it, it's going to potentially be smelly. It'll be pus. You'll have ooze. You know, it could be yellow. It could be green. It could be gray. It could be brown. And one might think, oh, well, I'll just have them rinse and they're going to be fine. And the answer to that is a big no. because unfortunately, if we pop that thing, just like if we popped a zit, you know, I mean, I'm sure you've heard the horror stories of, you know, someone had to be hospitalized because of bacteria went internally and then the face
Right.
blew up or around the eyes or whatever. Literally
Yeah.
the same thing can happen in the mouth. And what can also happen in the mouth as well as on the skin is sepsis, right? Which is the infection of the blood due to bacteria, which once again can be 100% prevented if properly taken care of. And if you see one of those, you know, those bubbles or those zits or those whiteheads inside the mouth, you don't want to touch it. You definitely want to call a medical care provider, ideally a dentist, because then we can evaluate, put on antibiotics, you know, first to help make sure that the infection stays local, and then unfortunately, whatever tooth that's assigned to, then we would have to take the tooth. The good news is, once the tooth is gone, once the source of the problem is gone, that thing's not coming back.
Yeah.
That abscess is not coming back. The source of the problem is the tooth.
Okay.
So a lot of times, if that thing has been there, and this can change depending on the dentist, but usually for me, if I find out that this thing's been there for 72 hours or longer, I want to make sure this person's been put on antibiotics. Also, usually they have a compromised immune system, even more reason for that. But I want to make sure that if there's any additional bacteria that's going around, I want that shrunk. I want that localized. I want it compacted. I want to get rid of all the extraneous stuff so that when I actually go in there and I do take the tooth, we don't have any post-op problems, you know, down the road. Yeah. So that is a very serious issue that we definitely want to make sure that we don't have, period.
Yeah.
Another problem is loose teeth. You know, especially for those that can't communicate with us. We don't want them choking on them. I know that sounds absolutely horrible, but it's happened, you know? So we want to make sure, oh, well, you know, they'll fall out eventually. Well, yes, potentially, but they're not children. You know, they're not baby teeth. You know, when a baby tooth falls out, the root has completely shrunk. We're looking at maybe a 3 millimeter, I mean, you know, a quarter of an inch to a quarter, I mean, really tiny little piece that can't cause a problem to anybody, right? They're meant to disintegrate. Adult teeth, that is not the case. When an adult tooth is loose, you've got a full root there. You're looking at something that's going to be, you know, it can be choked on. Let's put it that way. And so we don't want to wait and see on that. That is another situation where the dentist really needs to be called. Usually antibiotics don't even have to be involved, but those teeth have to be taken because we want to make sure that the airway stays patent. Right? We want to make sure that we don't have a choking hazard. And unfortunately that can be, and that's why I had to take those 8 teeth out on that other woman, because they were horribly loose. She wasn't closing her mouth right. It was a serious situation. She's great now. She's much happier now, but at the time it was pretty bad.
What about chip teeth? Like chips?
The dips in the teeth?
Yeah.
Yeah, and you know, and that happens a lot, especially for those that are clenching and grinding. You know, for those that are on dementia medications like the I'm not going to pronounce it right. You know, you have that horrible grinding that can occur, and eventually teeth will chip. You know, I'll be honest with you, if it's not bothering them, I kind of leave alone. I can use a Dremel based, you know, drill bit to smooth them down, and there's also handheld, air-driven, you know, high-speed hand pieces or drills to help smooth those teeth down. I don't like to take a tooth unless I really have to, especially because it's so traumatic for the body. It's so traumatic for the system. I'd rather be able to work with what we have. And if it's, you know, based on a situation where, you know, I'll be perfectly frank, if it was my own mother, she chipped a tooth, it's not sharp, she's still eating fine, she's smiling, she doesn't even know that it's occurred, I'll leave it alone. You know, sometimes less is more. You know, if the patient is not aware where it's not affecting their, you know, their self-confidence, right? And it's not really bothering the mouth or causing any problems or you know, potential health hazard or source of infection, I leave it be.
Yeah, and I think a lot of things that we've talked about revolve around bacteria in the mouth. I think it's also, I'll let you reiterate the fact of that morning brush. You know, a lot of times we have the misconception, or what I've been told anyway, is that, you know, our morning brush is not to really remove a lot of food particles. It's more to remove that bacteria that's built up overnight in our mouth. Is that?
I prefer it after breakfast though.
After breakfast? Okay.
Yeah, well, we're trying to get rid of the junk that we haven't swallowed after a meal, period.
Okay.
So if we can brush after breakfast and after dinner or / before bedtime,
Right. Okay.
as per our lifestyle, that's really the best way of doing it. If
Okay.
someone wants to rinse their mouth out, now we'll say this for those that have dry mouth, right? What I recommend is and I please understand I am not sponsored by anybody yet, but I'm not sponsored by any,
Yeah.
not sponsored by anybody, but Biotene, B as in boy, IOTENE, Biotene, wonderful, wonderful, wonderful product. Why? Number one, over the counter, so it's economical. Number two, it is swallowable. All Biotene products are swallowable, from the toothpaste to the mouthwash to the gel to the spray. I think they have lozenges now. They're all swallowable. They're meant to be swallowed. Why? It's pH neutral, so it won't affect the tummy. Number two, it will help coat not only the mouth, but the back of the throat, where if someone wakes up with chronic dry throat, sore throat, because they're not producing enough saliva, then the Biotene is a great product. And so what I tell people to do is to put it on their bedside table. And so they will have it on their bedside table. And yes, water is important, but then you got to pee 20 minutes later. Let's be honest.
Yeah, right.
You do a swig, right? And you do a
Okay.
swig of the Biotene. That's not going to happen because the majority of it won't even reach our guts. It's coating the back of our throats, and it lasts longer than water. Water will evaporate, but this won't. And so I tell them to do a swig of it before they go to bed and do a swig of that in the morning.
Okay.
So yeah, so when they first wake up. And the great thing about it is that it's got an additive effect. So the more often you're using it, the better it works.
Okay.
So yeah,
Cool.
so that is something that I truly recommend first thing in the morning. If someone has, chronic bad breath or usually due to dry mouth, then doing a swig of that is perfectly safe, absolutely wonderful, clears the palate, have some water, have your breakfast, brush after.
Okay. Awesome. So let's get back for just a minute. I know we need to wrap up. We're running long on time, but I have a couple questions about the timing of care. If there is nothing wrong, do we still keep that on the same 6 months, or as we get to a certain age, do we need to shorten that or lengthen it?
That's a great question. The American Diabetes Association recommends that patients get oral exams 3 times a year, not just twice a year. And the
Okay.
reason why is because those that are diabetic are more prone to oral health issues, and they happen a lot faster. So those that are diabetic, it is strongly encouraged, and I see all my diabetic patients, regardless how stable they are, whether they're taking insulin or not, they are all being seen 3 times a year, period.
Okay.
But other than that, for those that have teeth, even if they just have one tooth, there's still a source of a problem. I will see them every 6 months, unless of course they need to be seen more frequently because it's too difficult for the loved ones and the caregivers to provide proper oral care. And that happens, even with the best of intentions, that does happen. And then I also, for those that are completely edentulous, that are completely without teeth and that have dentures, I do strongly encourage for me to take a look at them once a year. Once again, it is a lot easier to reline a denture when it just starts to get loose than in a situation like for example, for this particular stroke patient that I saw yesterday. He had this stroke in September. He's been slowly dropping the weight. It's only within the last month that they've noticed that he can't wear the denture. Perfect time for me to come in and help to change that outcome for them. But yeah, so those that have dentures, I still recommend having them looked at, checked once a year to make sure there's nothing, and once again, not to get too gross, but nothing's growing inside the denture. Plastic is porous, as well as, there's nothing going on in the mouth. We want to make sure there's no wear facets. We want to make sure there's no potential wounds because of the denture, just because it might be rubbing too hard on the mouth, so on and so forth.
Okay. And then the other question would be, so somebody that may be non-communicative or that may not be totally with it, if a caregiver is brushing their teeth, is there something that do they need to look in, or maybe even get one of those little mirrors, or what do you recommend for those?
That is a great question.
In between visits.
In between visits. No, absolutely. Yeah. You do the best that you can with what you got, quite honestly. Yeah. Okay. If the person's clenching and they only allow this, then you only brush the front of the teeth.
Yeah.
If you can't get the inside, you can't get the inside. the effort has been made. So if you can, you know, a very common thing that we can do is that if the person if it's got pierced lips, if you lift up the lip and then get your hand around, you can try all day to light on me, but you can't.
Yeah.
So if your hand is out like this or out like this, and now you can get the toothbrush in there and brush away, fantastic. And if it's 30 seconds over 2 minutes, you got 30 seconds in. That's a win.
Okay.
That's a win. So you do the best you can with what you got. Water picks are very nice too, especially the handheld ones are waterproof. So if they're in, you know, some kind of like a shower, you know, if they're, you know, being taken care of that way, or they can even be brought in so they're not creating too much of a mess. Water picks, the professional water flossers from Waterpick. Waterpick. Fantastic product to get in there as well. It can make some a mess. Sometimes they don't really like it, but that's another really great way to try to get in there. But once again, we do the best that we can. Just want to be consistent about it. We're trying twice a day.
And on the water pick, is it just water, or is it one of their products that you use?
Great question. I really like the 1 part hydrogen peroxide, 2 parts water.
Okay.
It's safe, it's effective, it's cheap.
Okay.
Gums love it. Not any stronger than that though. It becomes too much of a good thing. So yeah, so one to two. 1 part, 2 parts.
All right, one last question and we're going to let you go, I promise. But toothbrushes, I know there's been a big move to the battery, and now they have a lot of rechargeables. Better, I mean, I know anything's better than nothing, but if we have the choice of getting the electric, better, worse, about the same?
Great question. So yeah, so 85, so there was a huge study that went out. Suffice to say, toothbrushing with a manual toothbrush, we're usually brushing for a full 2 minutes, even though we're supposed to. It only gets rid of the 70% of the gunk in your mouth. So now you got to floss, the other 30% dependent on floss. The electric toothbrushes, it's been proven time and time again since the late 90s that it gets rid of 85% of the gunk in our mouth.
Okay.
So yeah, so that is a significant difference. We still are reliant on our floss at 15%. I will say, however, that those that do have dementia, and it doesn't really matter in this situation what type of dementia they have, maybe excluding Parkinson's, they really don't like the feel of the vibrations in their mouth. They don't, you know, they're beginning to not even like feeling water on their skin, right? I mean, they're very temperature sensitive. There's an avoidance, an aversion to that. So as much as we would try to want to use the electric toothbrush because it's so much more efficient and because it does such a thorough job, there's a really good chance that they're not going to want it, especially if they've never used one before. They'll have nothing to be able to compare it to. They're not going to understand, unfortunately. So sometimes you're better off using something that they're familiar with, which is the soft, regular toothbrush.
Okay. Well, awesome. Well, before we go, any last parting words or anything else that you'd like the audience to keep in mind as we close up on oral care?
Yeah. If you have a loved one or you are a loved one yourself and you are noticing an oral issue, chances are it is a pretty common one. You're not the only one. So please feel free to reach out to me. I hope that you provide my information so that they can reach out to me.
Yes.
The best way of email. The best way of getting a hold of me is by email. And I welcome questions and concerns. I welcome to be a resource. Because,
no, I was just gonna say we'll give you a chance to put all your information out there.
Great.
So, what is a tool? Something that you use, may not be oral related, but a tool or a habit. What is something that you do that really adds value to your day, either professional, personal?
Like journaling or
Yeah. Sorry.
That's okay. Like that's a really broad question.
Yeah.
Well, now that the weather is getting better up here in Chicago, my husband and I are trying to walk more.
Okay.
So I miss walking. I lived in, New York. I lived in Milwaukee, never had a car, walked everywhere, was forced to walk everywhere, loved it. My body loved it. Now that we live in the burbs and, I drive everywhere now and it doesn't feel good on me, Walking is so much better. So walking is something that helps clear my mind and being, being out in nature. We're looking forward to going camping.
Okay,
We love
awesome.
to go camping. So that's something else that we're looking forward to doing. And now that we're both getting, I've been fully vaccinated and my husband will be vaccinated. We're looking forward to doing that and just being out one with nature.
That's good.
We love it.
Yeah.
We love walking.
Taking that walk for me, it really clears my head, and it scares Terry when I come home because I usually have a whole page full of ideas or things that I've thought about when I've had a chance to really think and get a
Oh my God.
Camera so I can take more. I take more pictures for my Instagram posts, right?
Yeah, right.
And the last time I took my camera out, it was still too barren out here. I'm like, no, I want spring. This is not
Right.
spring yet. So I'm hoping today, maybe I'll see some green.
We have got some green starting to come up here, so it's not too far away. Not far away.
That makes me happy.
Yeah. Well, Dr. Joy, thank you so much for taking time. And I know we ran way over, but it's been such an awesome talk and we appreciate it. So tell everybody not only, kind of who you can help, how you can help them, but what you can do for them. And then, of course, how that they can reach out and get a hold of you.
Fantastic. So yeah, Dr. Joy Poskozim, Joyful Dental Care. I'm based in Chicago and I go all over the Chicagoland area. However, if you need a resource and you're having a difficult time finding one, please feel free to reach out to me at office@joyfuldentalcare.com. That's joyful with one L, office@joyfuldentalcare.com. Feel free to reach us at the office too at 773-736-7767. But yes, email is the best way of getting a hold of me directly, even though it says office. That sounds very professional. But the email goes to me directly. So feel free.
Okay.
You'll know that it'll be safe. You'll know that it'll be HIPAA compliant, and there will not be any problems with privacy.
Yeah, and we'll be sure and put all that in the show notes as well for you.
Excellent.
All right. Well, thanks a lot. So y'all give Dr. Joy a call, especially if you're in the Chicagoland area, if you have a loved one that can't get out. Let's get everybody really need to start thinking about oral care. It's so important for us to live. One of our new phrases that we use is we don't want to outlive our wellness. And so getting the proper oral care will certainly help with that too. So that's going to do it for another episode of Educational. I'm Roy.
I'm Terry. I need to go brush my teeth.
Yeah, we're both going in there to brush our teeth now. I'm just sitting here feeling bad. Yeah, you can find us, of course, at www.educational.com. We're on all the major social media platforms as well, and we are on all the major podcast platforms, iTunes, Google, Stitcher, Spotify. If we're not on one that you listen to, please reach out. We'd be glad to get it added. So until next time, y'all take care of yourself.